effects of these. So what are some of the side effects that maybe comes out of using this system? And of course, when we talk about this, it does not really mean that it is because of the system, but because of the general treatment of cancer.
Yeah, actually, because this equipment has reduced the number of, that is the amount of time of treatment. Actually, the side effects are minimal. There is those common side effects like vomiting, diarrhea for some different types of cancer, and fatigue. But for this one, when it comes to the major one, that is the darkening of the skin, it has been completely catered for this equipment. You don't see any side effect of the darkening of the skin for this particular pipe.
And why is this so?
One is that the minimum time for per treatment taken, and then also there is this unique, the dual layer of MNCs that comes up with. It helps you for to cater for the exposure. Yes.
So somebody back at home may be thinking that when I'm sick or when I have cancer, that I can only use this treatment and then I will be sorted out. What do you have to say to them? And that also may also bring out a question that, is this the only available treatment for cancer patients?
No, radiotherapy is one of the modes of treatment for cancer.
And you did mention that we have radiotherapy, we have chemotherapy, and we also have surgery.
Yes.
Yes.
Actually, it's the doctor who usually just stipulates what needs to be done. That is, the doctor can be in a position to say that he or she wants to start with surgery, then chemo, and then radiotherapy, or he or she can be in a position to do, that is, chemo irradiation, the combination of all of them. Yes.
So all you're saying is that this is not a standalone treatment. You have to use it in.
Yes. Yeah.
And also now, when we're talking about that, also something that may come out of it is that, so the duration of treatment. Does the doctor also tell you that you're going to take the treatment for this particular period of time, or what is the mode of treatment for you to be certified cancer-free?
Actually, it depends with the type of the cancer and the prescription that the doctor gives. Yes.
And we also had, I don't know if we've talked about this, but we have so many misconceptions about treatment of cancer. And right now, one of the legislators, the Kibra MP, is sick.
Yes.
Is suffering from cancer, and that does not. That also brings something that this is not something for the poor. It affects people across the board.
Yes.
So, what are some of the strategies that maybe the government may put into place, just like what the Nairobi West is doing, to make sure that this thing is really curbed, is really maintained?
Actually, some of the challenges that the whole society is experiencing is the lack of awareness, of which Nairobi West has been doing that. Actually, here we have been doing the screening of different types of cancer. Also, the other thing we need is that that is the society needs to go for, that is the medical checkup on their own. That's another thing. And then also that is they need to be in a position to visit their doctors and be in a position to be checked. Yes.
Is this system specific for a type of cancer or for all the cancers that we are having in the region?
Actually, this one is for all types of the cancer, except the skin cancer, because it's widely distributed. Yes. The
skin cancer. So when we talk about prostate cancer, breast cancer, and all of you, these can be able to tackle.
Yes. Yes.
Yeah. In the treatment of cancer, what are some of the challenges that may come out of it? Some of the challenges.
Actually, the biggest challenges is about the money, the funding, because so many patients are supported by the insurance, and then actually, if you just compare with that is our society, most people can't be in a position to afford the full cost of treatment of cancer. Yes.
We also think about other in terms of maybe what the NHIF should maybe should they be involved more in the treatment of such cases, because this is not only, it's a menace right now.
Yes, I think so. Yeah.
Okay, so in your final words, do you have anything to maybe tell us about what the way forward for the region, because this is one of its own in the Africa, in East and Central Africa?
Yeah.
Would you encourage other people from other nationalities to come to Nairobi West?
Actually, one thing I can say, cancer is not a death sentence. We in Nairobi West, we are saying battle is on, and we are together in this journey of fighting against cancer.
Yeah,
yes.
And just a slight thing before I forget, in something which has not really escaped my mind, is the room in itself.
Yes.
What really made you focus on maybe having these good colors behind me here?
The design comes that is from our own way of doing things in Nairobi West, whereby that is when the patient comes in, we want to be in a position to feel isolated. Actually, it's a design of the sea beach, whereby you can be in a position to watch aloud and feel that you are comfortable.
It's very relaxing, I must say.
Yes.
And also, that also talks about the machine itself. It's kind of different from other machines.
Yeah, actually. It's a boat-shaped, which looks like a city, whereby the gantry is in-house. You want to be in a position to see the gantry, or the collimator. Actually, this improves the patient, even the safety of the patient. Yes.
Any final words do you have to tell us about the whole system?
It's one is accuracy, and then it's user-friendly, and also that is another advantage is it's friendly. Yes.
So thank you very much, Mr. Ngure, for hosting us here at the Nairobi West Hospital.
You're welcome.
I'm looking forward to coming back and discussing more about this system and how impactful it has been to the society.
You're welcome.
Yeah. So to our viewers back at home, we have this system here at the Nairobi West Hospital, which has been able to cut the time for treatment from around 40 minutes, around 2 minutes. It's accurate, it's quieter, and it's very effective. So if you know someone out there, or if you've been affected in any way and you need treatment, this is the place.